Hello, friends, and welcome to another episode of the Concussion Nerds podcast. In today's show, we are talking all about acute concussion. You have a concussion, now what? Because in truth, so often this misinformation is given out in the early phases. And so I'm hoping you can use this podcast episode as a copy this link, drop it to who needs it, so we can get people on the right path sooner. Hope you enjoy the show. And so I think it's important for us to start with, well, actually, I'm going to start with a story, and then I'm going to dive into what I thought I was going to start about. We want people to be set up with understanding what's happening in their brain and knowing those immediate and initial kind of first steps once someone has a concussion, to be able to identify what they're going through, to understand what comes along with that, and to be able to know who to connect with to help them get them on the right path for recovery sooner. And this reminds me of a client that we just had not too long ago come to the clinic. And I connected with her. It had been about 17 to 20 days after her concussion. And we were connected via just a mutual colleague or a mutual friend of ours. And I sat down with her and had an hour conversation and kind of shared some of the things I'm going to share in this episode with you today. And she said to me, Natasha, I've learned more with you in this hour than anyone's been able to tell me so far. Right up to this point, 20 days into her recovery, she was still spending most of her time in bed. She hadn't been started on an aerobic program. She was kind of flabbergasted on how much this concussion was affecting her life, and no one was giving her a plan to how to move out of it. And so this podcast, I'm hoping, is going to be a tool that you can use, that if you know someone in your life who's had a concussion, it can be something that you can just drop to them. So I think it's important to start with the definition of concussion, right? Let's understand what a concussion is. Let's understand some of the red flags around concussion, right? A red flag means an immediate trip to the emergency room. Let's also understand the signs and symptoms of concussion. There's a quote, it was by a para-athlete that I have it in one of my presentations, but her words were, you can't expect a concussed person to know they're concussed. One of the symptoms and the signs and symptoms of concussion is confusion, right? Is that lack of awareness piece of things. And so if someone with concussion has these symptoms, how are they going to know they're concussed? So as family, as friends, as team members, as colleagues, as bystanders, we all need to be kind of familiar with the signs and symptoms of concussion so we can help identify it in other people as well. I thought it was a wonderful quote, to be honest. So let's start with the definition of a concussion. Okay, this is in previous episodes, but it's important. So this definition comes from the most recent consensus in sport from Amsterdam this past year. And so obviously in this definition, it is called a sport-related concussion, but we know here on the Nerds podcast that concussion can absolutely come from sources other than sport. Right? One of the myths and one of the reasons that I hear people tell me they didn't think they had a concussion was because they didn't play sports. And so we want to kibosh that. So this definition comes from the international consensus on sport and concussion in sport. But we know that concussion can come from falls, can come from motor vehicle accidents, workplace incidences, domestic violence, right? It can come from any number of places. So we'll just keep that in the back of the head. But a concussion is a traumatic brain injury caused by a direct blow to the head, the neck, or body, resulting in an impulsive force being transmitted to the brain. This initiates a neurotransmitter and a metabolic cascade with possible axonal injury, blood flow changes, and inflammation affecting the brain. Symptoms and signs may present immediately or evolve over minutes or hours, and commonly resolve within days, but may be prolonged. No abnormality is seen on standard neuroimaging studies like CT or MRI or X-ray, but in a research setting, they may show up on functional or blood flow or metabolic imaging studies. Sport-related concussions result in a range of clinical symptoms and signs that may or may not involve a loss of consciousness. The clinical symptoms and signs cannot be explained solely by alcohol, drugs, or medications or other injuries, although they may be coexistent, and cannot be explained by psychological factors or other medical conditions. So when we're looking at this, right, what this is saying is that something has happened within our brain, right? So this neurotransmitter, this neurometabolic cascade, which is talking about specifically the inflow and outflow and influx of calcium and potassium and what that's doing to the nerves and the neurons within the brain, right? There's possible axonal injury. There's blood flow changes. What has happened is, although we can't physically see anything, right? You don't see this on any imaging. This is why if the physicians, if you go to the emergency room, are not concerned with a fracture or a bleed, they don't order imaging because it will not show a concussion. But physiologically, we know that there's things happening within the brain. And ultimately, if I had to break this into like non-sciencey language, there is an interruption in the highway of your brain. So picture how we communicate, right? Picture a highway. So we move from point A to point B on a straight path, right? There's no construction. It's smooth sailing. This would be information traveling from one part of your brain to the next. Smooth sailing so you can function. What a concussion does is it messes up that highway, right? So it throws a roadblock or it throws an obstacle in the way or construction, right? So information can no longer efficiently travel from point A to point B. It either has to slow rate down and some pieces get lost in the process, or there has to be a detour. So now all of a sudden, something that used to be really quick and fast and efficient now takes longer, it takes more energy, and it doesn't work as smoothly. So this is, if I had to bring it into like layman's terms of what's happening with a concussion, this is a little bit of what's happening. Another example that actually, I believe it was in Dale Earnhardt Jr.'s book, when he wrote about his concussion experience, that I really liked is picture it as a garden hose, right? When you have a garden hose and the water is flowing out of the hose uninterrupted, you have this great stream of water to water your garden. All of a sudden you get a concussion. A concussion is like a kink in the hose. Again, it disrupts the flow and the amount and the efficiency of the water leaving the hose. The kink is the concussion. And so to restore that free flowing of water, you need to rehab or restore the kink. Okay? That is the definition of a concussion. The other piece that's really important is that it says that it can happen over a moment. Symptoms can show up immediately, or they can show up in minutes, or I'm going to like tweak this a little bit. They can show up in days. And the reason I say days is because if you are someone that goes and rests and just kind of sleeps right away after a concussion and you don't begin anything, and then you just like dive into regular work, and that regular work exceeds your brain's capacity in that moment, then you're going to get symptoms. So you may have been fine for the couple of days while you rested. And then unfortunately, some of the advice is take a few days off and head back into work. And then you do that and you trigger all your symptoms. So that is the definition of a concussion. Let's look at what the signs and symptoms of concussion are. So when you're looking at the signs and symptoms of concussion, and then we're going to talk about red flags, you could kind of break them into a physical symptom or sign, an emotional kind of piece, and a cognitive piece. Okay, so physical symptoms, some of the really common ones obviously are dizziness, headaches, light and sound sensitivity. There can, of course, be neck pain, blurred vision or double vision, balance challenges. These are all really common physical signs and symptoms of concussion. That other category can be more that emotional, cognitive piece of things too, right? The emotional piece. So we have irritability, we have crying, we have uncontrollable emotions. There's anxieties that show up, there's depression that shows up. That piece of things too, that emotional kind of piece, that affective piece. And the other big, I'm saying category of symptoms. So if you've listened to the phenotypes episode, this is not phenotypes, this is just categories of symptoms, okay? The other is the cognitive. So this would be someone feeling like they don't feel right, like it's taking them, it's harder to think. It's slower to process things. They're having word finding issues. Those are some common cognitive symptoms, memory challenges. They're repeating things, right? So there's a significant number of signs and symptoms of concussion, but those are some of the common ones that show up. So again, we have the physical symptoms, signs and symptoms that show up. We have kind of the emotional pieces that show up, and then we have the cognitive pieces that show up. And then we know that many of those symptoms will fall into many of the different phenotypes, right? The red flags are important. And a red flag, and the reason this is important is because it could mean and could be indicative of a more significant injury. So a red flag could be significant of like a bleed in the brain or a fracture within the neck, depending on the mechanism. Okay. So if there's a red flag, where you're seeing a scenario that there's any red flags, that person needs to be taken to the hospital right away. And in many cases, that might mean you're calling an ambulance to take them to the hospital. But the reason, if it's immediate places, but also red flags are there because they can be developing over time. So this is why we say in those initial couple hours or few hours after someone has a concussion, we say 4 to 6, that you don't want them to fall asleep in that time window. Because if some of these symptoms are going to progress, they're going to get worse over this 4 to 6 hour window. And so if this starts to happen, again, it's a trip to the emergency room. What are some of these red flags? This would be a headache that's getting worse. Okay. So if they had a bit of a headache, but it's really not settling and it's continuing to get worse, that's a trip to the emergency. Slurred speech, weakness or numbness in any of the extremities, particularly the arms and the hands, or if you're noticing decreased coordination in the body, repeated vomiting or nausea, if they are going into convulsions or seizures, if they're having really unusual behavior or there is a lot of confusion, they're repeating sentences over and over again, or there's a lot of restlessness or agitation, ultimately, those are some red flags. You're going to take them to the hospital just to make sure there's nothing more serious going on. Okay. Really important. So if you work in a space or you work with kids or you work in that is a high concussion risk, please take the time to make sure that you do understand and can recognize those common signs and symptoms of concussion. There's a significant number of them, but then also that you're very familiar with those red flags so that way you can help get someone on the right path sooner. Now say you're someone who has a concussion, right? Let's talk about kind of the phases of recovery here and what we need to do within each of those phases. And some of these are going to extend into definitely bigger episodes where I go into more detail on some of these topics. Today, I want to give you kind of this high level overview. When we're looking at a concussion, we're looking at phases of recovery. So we have an acute phase, a subacute phase, and then we move into persistent. Okay, so an acute phase is that first 72 hours after concussion. Okay, that subacute phase is 72 hours and beyond. Now, depending on where you read, some will say that subacute phase lasts up to 14 days, so 72 hours to 14 days. And some papers will still say that subacute phase goes from 72 hours to the first month and to the end of the first month, so 30 days. And then if you're moving beyond 1 month after injury, you're now shifting into a persistent concussion phase. Okay. Ultimately, for adults, many adults recover and are symptom free within that first 10 to 14 days. Okay. We're going to talk about what's happening in the brain then, but many will be symptom recovered kind of within the 10 to 14 days. For youth recovery takes a little longer. So it is normal for youth to take up to a month for this recovery process to happen. Okay. In the acute phase, this is where we truly do want cognitive and physical rest. Okay. Our brain is functioning in kind of an energy crisis area. There's a lot happening within the brain itself from a metabolic component, right? It does not have enough energy to do as much as it normally does. And so we do need to give it rest in these first 2 to 3 days. The research is now showing us that beyond this time frame, however, this can actually be counterproductive to our recovery. So we're going to talk about that in the subacute phase. So in this acute phase, up to 72 hours, we want rest cognitively and physically. If you do begin to do activities because you're feeling all right, we want you to stay below symptom exacerbation, which ultimately means if you start to do a task and it starts to elevate the symptoms you have, please pause and do an activity instead that brings your symptoms down. You want to let yourself sleep. If you're tired, sleep. Okay? Don't feel like you have to get up and all this thing. We do want to shift as much into a regular wake sleep routine in the subacute phase as we can, but in this phase, let yourself sleep if you're exhausted. Stay hydrated, drink lots of water. And although this isn't necessarily a staple thing with myself and with colleagues, I want you to encourage you in this phase too, if you are hungry and when you eat, to avoid poor nutrition and food choices, right? Avoid the fast food, avoid the junk, right? We know that what's happening in your brain is an inflammatory process, right? It's inflammation. And so let's fuel our bodies instead with nutrition that can support that inflammation instead of potentially adding to it, right? If you go back and actually listen to the podcast episode we did with Dr. Mark Heisig, who is a naturopath, we actually talk in that episode about some supplements that he will recommend clients take in this acute phase as well to potentially help that inflammation stage as well. Okay. So the first 72 hours, you get to rest. That means no going to school, no going to work. Like truly let your brain be and recover. Okay. From that acute phase, you move into subacute. So subacute is that 72 to 14 days after. Okay. So this time period right here is when I recommend you connect with a concussion literate provider. Okay. And remember, when we're talking about concussion literate, we're talking to a provider who understands the holistic aspect of concussion, the multiple systems that are affected, and they will be able to guide you in what we call the multi-systems assessment. So they'll be able to look at the multiple domains and get you started on a beginning plan. Okay. My recommendation is to connect with a person on, ideally, if you can, day 3 to 4, but within the first 7 days. And we like to do this because the research absolutely supports recoveries going smoother and more, and honestly faster, when you are connected with a provider to help guide you through things like gradual reintroduction of activity and subthreshold activity. Okay. So the research supports it over and over again. Also, to have that provider be able to explain what some of those symptoms are that you're having and why you're having them. So what this provider is going to do is they're going to do a more thorough in-person screen. So we've talked in a previous episode about the 7 phenotypes of concussion, and they're going to do a screen to see which elements and which systems of your brain are you currently struggling with, right? From a screening higher level. And then they're going to support you in giving you a structured and supervised gradual aerobic exercise program. And we do this because, again, from an evidence-based, research-based perspective, we know that those that we can get started on a gradual exercise aerobic program sooner helps facilitate recovery. So what your provider is going to do is they're going to guide you through how we do this exercise. They're going to guide you through how hard to push, when to stop. They're going to give you structures around times. We're going to do an entire podcast episode on this alone. But in the beginning, if you're listening to this and you know someone, you're going to that subacute and you're waiting to connect with a provider, just starting to move your body, right? Whether that's going for a light, I say starting to move your body, I don't just mean with stretching. Okay. The beautiful thing is the research study actually supports aerobic activity, which is moving your body in a cardiovascular way versus just stretching stretching doesn't count. It's important and it keeps you moving, but we want you to challenge that heart rate a little bit. So if you are a healthcare provider listening to this, obviously we're going to do a whole episode on how we guide this. Sorry, I hit my mic there. But if you're listening to this, we just want to get you moving, right? So maybe that is going for us a gentle walk around the block. Maybe that is getting on a treadmill and doing a gentle walk on the treadmill. If you have a stationary bikes are absolutely my favorite to start with, to be honest, because you are seated. You are minimizing the effect of all the systems, right? You're minimizing the effect of the cervical spine. You're minimizing any vestibular or visual stimuli. And it really can be more of a cardiac and cardiovascular focus. So the stationary bike is kind of my go-to for all of my clients to begin with. So if you are listening to this and you're like, I want to start moving my body, I have a treadmill, I have a bike, and I can go outside and go for a walk, to really start to challenge that heart rate, my recommendation is always the stationary bike. Now, this is a gradual sub-threshold plan that needs to happen. Okay. So that does not mean we're going to dive into 30 minutes or a 5K right off the hop. And I say this because although it sounds like it should be straightforward, for clients that I work with that exercise is a regular part of their life normally, to them jumping on and just like going for a 30-minute ride or doing a 5K is less than normal, but then it wipes them out for the rest of the day. So we start slow. Okay. Your therapist will work with you on finding that starting heart rate, right? So ultimately what we want to do is we want to get our heart rate pumping a little bit. Ultimately, a safe number to start with is you start at 50% of your heart rate max. You find your heart rate max by going 220 minus your age. And then 50% of that number is a nice starting safe heart rate to begin with. It's in the literature. It's been used plenty of times. So if you don't have someone to take you through a structured test, this is a good starting point. Okay. You start at 50% of your heart rate max. That's your target heart rate. And then you move your body, whether it's walking or whether it's on that stationary bike. The first day you do this, you guys, set a goal of 15 minutes, a goal. But then you stop if your symptoms begin to elevate greater than 1 to 2 points, or if when you finish the activity, you are not back to your baseline within 1 hour after the activity. So let me phrase that a different way. If you go to do a stationary bike, you figured out that you're going to be at 50% of your heart rate maximum, and you go for 15 minutes, but at 10 minutes, you notice your symptoms are increasing by 2 points. Now, how do you know what a symptom increase is? It's either A, the current symptoms you have are getting worse. That would be a point. If any new symptoms show up, that is a point. Okay. So you will stop the activity or decrease the intensity of the activity if your symptoms increase by 2 points, or you notice that when you've completed that first session, you are not back to your baseline within an hour after. Those are indications that we need to scale back on the intensity of your exercise, and we will do another episode specifically about this. But to get you started, that's what we're looking at. So we want to begin with a gradual, structured aerobic exercise program, which means, unfortunately, for my client who I had connected with, who was on day 17 or 20, and this hadn't been explained to her, she was super excited when I said, we need to get you moving, because she loved to exercise and no one had guided her through how to do this yet. The other piece, starting on day 3 to 4, is that we actually want to begin to gradually reintroduce other activity and life demands as well, right? So if you are someone that has to work and you work on a computer all the time, we're going to start to increase the amount of screens you're on. We're going to start to challenge and increase the amount of cognitive activity we're doing. But we're going to do that with the same guidelines we were using for the exercise. Okay, the big thing here and the reason things need to be done gradually is because your brain is still operating at an energy deficit. Okay, there's still blood flow issues. There's still neurometabolic issues that have not fully resolved at this stage. The research will show us it can take up to 28 days for this to resolve. And so we need to do this gradual addition of activity because it allows us to monitor ourselves so that we do not exceed the brain's capacity to integrate and execute the task. This is why gradual is important. Your brain has not fully healed, whether you're still having some symptoms or not. Okay? If you start doing a task and your symptoms elevate and you ignore it and you keep pushing through it because you have to get stuff done, you are setting yourself up for a longer recovery process. This is really hard for most people. Most people are very driven. Most people have plans and deadlines and things they want to be able to do. And when life throws you a wrench like a concussion that is completely out of your control, it is really hard to not just push through it because you have to get A, B, and C done. But if you push through it and you ignore the symptoms increasing and you push your brain past what it's currently really capable of, you're setting yourself up for a longer recovery. Now, if you are listening to this and you are in the persistent stage and you're like, that's what I did. I didn't listen to my symptoms. I just pushed and I could have done better. Please just pause. Please stop. Please give yourself grace because you probably didn't know better. But the beautiful thing is that it's never too late. So yes, we want to be able to begin activity and connect with a provider sooner to facilitate a faster recovery. But if that's not you and you are now in this persistent stage, please know it's never, ever too late. Okay? So I'm going to backtrack a minute here. I'm going to go back to the subacute stage. So in subacute, we are days 3 to 14. We're trying to connect with a concussion literate provider, ideally on days 3 or 4, but before day 7. You guys, that can be a physical therapist, a chiropractor. It can be a naturopath. It can be an OT. Really, it's just someone who's well-versed in the space of concussion. So connect with them between days 3 and day 7. They will put you through a multi-system screen. They will give you a structured, supervised, gradual exercise program to get you moving. If you can't get the appointment till day 7, you now know that you're going to begin a gradual, slow self-exercise program for yourself. You know from this episode already when to stop and when you've done too much. And you know the importance of not pushing through and keeping going. Okay. We also know that within these days, this is when we're going to start to gradually reintroduce other cognitive and activities that are related to our life, treating them the same way that we treat our exercise, which means we're not pushing through and into those symptoms. Okay. Also, very much recommend, this is linked with the concussion literate provider stuff, but we want to start beginning targeted rehab no later than 10 days after your recovery or after your concussion. Now, personally, if you come see me on day 3, which is my ideal, and we identify that there's some vestibular dysfunction, I'm going to give you some vestibular exercises because it's not going to hurt you and it might help you. The research shows us that if there is vestibular and visual dysfunction, those can spontaneously resolve in our brains within the first 10 days. But the way I look at it and the way kind of you've heard other guests on this episode, on this podcast talk about it too, is why, if I can identify that there's a vestibular challenge or a visual challenge on day 3 or 4, why would I wait until day 10 to see if it spontaneously resolves itself and then start treating it? That is how I approach things. So if I see you on day 3 or 4 and I identify that there's a vestibular phenotype happening or there's a visual phenotype happening or whatever it is, we're going to start some small amounts of targeted rehab then, because I don't feel like it's not going to harm you, and it might help you with the recovery. I don't see the purpose in waiting another 7 days to see if it goes away, especially if you're already in my office. We're already working on your recovery plan. Let's just build it in. Okay. So we've talked about on this episode briefly what is a concussion, what's happening in your brain, the importance of us recognizing the signs, the symptoms, the red flags. Okay. We've talked about what we do in that acute stage, and that it's that first 0 to 72 hours. We've talked about what happens in the subacute stage, which is that 72 to 14 days. Depending on where you read, again, subacute can be 72 to 30 days. And then if we're shifting into persistent, then that is when absolutely we're talking with multi-systems, we're talking with providers, and we're getting, again, ideally, you're just continuing with the targeted rehab that you started with in the subacute phase. And if the targeted rehab needs to be a little bit more in depth, then we can talk about that then. We'll do a whole other episode on the persistent stage. But ideally, and this is the goal, everyone, is that if we can be on point with identifying the concussion and then executing proper first steps, that we are decreasing the amount of people who are shifting into the persistent stage. Okay, some of the studies last year that came out that showed within 46 to 52% of people were still not back to functional baselines after 6 months. What that study doesn't show us, and what those studies didn't tell us, were how many of those people had rehab in the first 7 days. So what we don't know, there's some gaps within that number for sure. But what the research continuously does show us, and is constantly recommended at this point, is that those who connect with a knowledgeable provider early get started on this path sooner. So I hope this episode, again, this is always me trying to keep these to like nice 30 minutes episode. I hope this episode just gives you some super high level insight into what we're looking for, why we don't do imaging in the hospital, right? What those red flags are, the different phases of your concussion recovery, and then briefly what we're going to do in this acute phase and this subacute phase. Know that there's a lot of emotion that can come through with a concussion. It can be scary because your brain isn't operating the way you expect it to. Please know that the symptoms that we talked about, the brain fog, the not feeling quite like yourself, sometimes there's like tingling or weird sensation changes, the dizziness, the lightheadedness, the memory issues, all of those symptoms are normal with concussion. Okay, they really are. And know that by definition, this is a transient and reversible injury. So I know this can be scary. And if you have clinicians, if you're listening to this, please voice that with our clients. Let them know that these symptoms are absolutely normal. And yes, it can feel overwhelming. And yes, it can feel a little scary, but they're on the right path. And and this is a reversible diagnosis. Okay. All right. Until next week, my friends, I hope you are having an amazing day. Thank you for listening to the Concussion Nerds podcast. Thank you for your passion. Thank you for being here. And we will see you soon.